According to professors from UCT, Mohammed G. Bay and Belinda Jacobs in 2009, occupational health services in South Africa are poorly developed and lag behind international developments. Sadly, that is still the case even today, 15 years later. It is a legal requirement that employers must provide a safe and healthy working environment for their employees. In terms of public health principles, it is important to control occupational and environmental factors in all workplaces. Having a robust occupational health service and working in partnership can lead to increased productivity, reduced absence, and money saved for employers. Having a workplace occupational health service gives staff and managers rapid access to professional specialist advice, which help protect, retain, and support staff with health issues in the workplace. The occupational health team has an advantage of being able to work closely with management to understand the complexities of roles within a healthcare institution and can therefore suggest adjustments to support that someone without that knowledge and understanding may not be able to offer. This can support staff with staying healthy at work and ensuring retention of workers in the workplace. Good evening to you all. Please join us as we outline the roles of those responsible for provision of healthcare in the workplace and services that can be accessible from the occupational health environment. Welcome. Okay, first we'll go through the house rules. I'm Dr. David Mkwanazi. I'm an occupational medical practitioner, travel medical practitioner, economic risk assessor, and exposure scientist. I'm also a health professional educator in training. This session is accredited for 2 clinical CPD points by HPCSA. Kindly please drop your HPCSA number, full names, and email address in the chat box to register for CPDs if you haven't done so prior to this event. For those who are not registered with HPCSA, an attendance certificate will be issued. Please keep yourself muted at all times to avoid interrupting the presenters. This session's attendance will be monitored for the entire duration of 2 hours. Kindly please ensure that you do not join using nicknames for cell phone names or aliases to be able to be identified properly. Each session will be podcasted on YouTube for long-term education and training purposes. We have realized that a lot of colleagues go back to our YouTube page to recap on the information that may have been missed during our sessions. In the future, we'll also add Q&A videos for questions missed during our sessions. We thank you for your continued support in this regard. The link and CPD questionnaire can be accessed on www.ohesa.co.za under webinars for those who wish to earn CPD points after watching the podcast. 70% pass mark is required to obtain these 2 CPD points. Participants will be allowed to ask questions or comment after every session. Questions can be posted in the chat box anytime during or after the presentation. You may also contact us for any information or questions after the webinar. Our email address is ohesa.dlp. DLP stands for Digital Learning Platform @gmail.com. Sit back and relax. The webinar is about to start. In today's session, we'll discuss the scope of practice for occupational health nursing practitioners. We'll also discuss the scope of practice for occupational medical practitioners, as well as other role players in occupational health. And then finally, we'll outline occupational health services structure in South Africa. Occupational health Exposure Academy was founded with the sole purpose of bridging the gaps between different occupational health professional fields and making sure that we all speak the same language and approach workplace problems comprehensively and collaboratively. Obviously, for the safety of our workers and patients, empowerment of ourselves, and productivity of our workplaces. Today's session is proudly brought to you by Corporate Industrial Medical Consultants in partnership with Occupational Health and Exposure Sciences Academy. Colleagues, for our first presentation of the evening, please allow me to introduce you to Sister Angela Butkovic, also known as Sister Angie. Sister Angie has Bachelor of Occupational Health Nursing from Technikon Witwatersrand, Bachelor of Nursing Education from University of Johannesburg, Masters in Occupational and Environmental Health Nursing from Wits University. She is currently the MD Managing Director at NGB Consulting Solutions. She's a member of SASHON, South African Society of Occupational Health Nurses, and International Congress on Occupational Health. She's currently a SASHON volunteer and Gauteng Regional Committee member. She's a previous associate lecturer at Wits University. She also previously trained many people at OXA Center of Excellence. She has done extensive work as occupational health nursing practitioner in various industries. In summary, she's a seasoned occupational health nurse consultant and creative nurse educator.
Good evening, colleagues. Glad to be with you here today, this evening. I'm pre-recording as arranged with Dr. Mkunazi and team. Thank you for the kind introduction, and let's get started on my part of the webinar today. Let's quickly share here. Share that, and we will just hide the controls. There we go. So hopefully you see the slideshow, and I'm tasked today with a quick overview of the OHNP's scope of practice in regards to occupational health services. We will answer any Q&A at the end with the kind assistance of Denise Minnie. So please make notes and we'll discuss now. In the short session we've got, just going to clarify a few concepts. We often have a mixed group of safety officials and hygienists and OC Health or registered nurses wanting to become OC Health practitioners, and OC Health GPs wanting to become occupational health practitioners as well. So just where the OHNP falls in with regards to the medical legal framework, our expanding roles, which then impacts the contemporary scope of practice we have today, and where we potentially will be in the near to far future. And this is being prompted by many questions that have come across SASHON and in our regular meetings or WhatsApp groups. So for instance, some colleagues are having to put together job descriptions for the OHPs, and then want to know what should versus what could we actually do. Some ask for why should we even contract or employ both the OHMP and the OHN. Some find that they don't see the OHN a lot and they start wondering, well, what are they doing all day? We've had requests where they've noticed that professional nurses are doing something similar and it seemed to be cheaper. That leads us on to the questions that come up about what is the difference between a staff wellness clinic versus the legally required occupational health services. We then have situations where companies start demanding tests from the mobile services, and when those results are handed over, they seem to then send it on to a local GP, and is this acceptable? Not to mention what standards should we be measuring up to when it comes to occupational health services. So let's focus on just a few of those concepts quickly. It is the International Labour Organization in Convention 161 that addresses what an occupational health service is. And these services entrust with essentially preventative functions and responsibilities to advise employers, the workers, and their representatives in undertaking requirements for establishing and maintaining both safe and healthy work environments that will facilitate optimal physical and mental health in relation to the work and the adaptation of that work to the capabilities of the worker in light of their current or state of physical and mental health. So yeah, you'll notice that we do both safety and health. Okay. The OC health practitioner, you'll notice that that comes up quite a bit, and it refers to both the occupational health nurse practitioner and the occupational health medicine practitioner. The International Commission of OC Health, which is ICO, considers the OHPs to be registered experts who have acquired additional postgraduate knowledge and skills to identify occupational hazards. So we do very similar to what the hygienists do, associated with both health and safety risks in a variety of workplaces, where they need to fulfill a number of roles that motivate both the management and employees to create and maintain a healthy and safe work environment where injuries and occupational diseases can be prevented, and or where the deterioration of existing medical conditions associated with those hazards and risks are mitigated. So you see there's a sort of a further development in the concept now of the other things that we do. Let's go. And the OHPs have the right to make autonomous professional decisions influenced by our dependent functions like laws and regulations and scope of practice, independent functions like, for instance, cooperating with other members of the SHEC team, independent functions. In other words, we remain responsible for our own actions and omissions, while being aware of the extent and limitation of our own knowledge, skill, and competencies. Okay. So that's an international definition. When we come to the national side of it, SANC basically defines what the OHN is here in South Africa, and they consider us advanced practice nurses. And there's two categories or levels to that. Once we've done a in-depth knowledge and have expertise in a specific practice, such as health, we become a specialist nurse, provided we have acquired a postgraduate diploma in that specialization and registered. For the advanced nurse specialist, the difference there is you still have your OC Health, but you've decided to go broader and do for instance, a master's and registered that with council. Okay, so you will see both categories in South Africa soon. Now to get to the OC Health nurse definite or concept. Okay, so although both of us, nurses and doctors, are an integral part of the safety, the health, environmental, and quality team, we function independently and make autonomous decisions after analyzing the data that we gather from clients, the work environment, and members of the SHEC team. So we work closely together. In specifics, the OHN is a nurse specialist with the additional competency that SANC has published at an SQF level 8 or higher in the field of occupational health nursing, where we then need to register that diploma with the respective council, meaning SANC, and would carry out the IOL, so from 1959's aims of a service in preventing injury, ill health, protection, promotion, monitoring, and restoring 3 things now: the physical, the mental, and the social health of employees in the workplace. Okay. So, in order to really understand our scope of practice, we need to read 3 documents together. It's the scope of practice, the practice standards, and the competencies that SANC have published. Okay. So what is the difference? The scope of practice addresses our roles, the description of the services we can give, and the boundaries in which we will do it in the occupational setting. Whereas the standards describe what is considered best practice by the profession. In other words, SASOM and SASON would get together and develop guidelines, which then influence the standards. Competencies, on the other hand, describes how those standards are going to be met. And we'll work on an example just now. It's important to remember that with the scope of practice, it is not a list of specific tasks. Those tasks come under the competencies. The scope of practice is influenced by health needs of both individuals and groups. So in the occupational setting, we've got different types of industries, for instance. The place where the nursing care is going to be provided. Our scope is determined by the level of our competence. Okay, in other words, the PG postgraduate diploma at level 8 now. The inclusion of policies and protocols of both healthcare providers, so that's where those standards come in, and relevant legislation. So in summary, scope of practice is the context in which we function. Okay. So let's have a look quickly. Here is the scope, that's a position statement by SANC. And what I've done is I've summarized it in the PowerPoint for you.
Oh, like yes,
As mentioned, it's going to encompass encompasses the standards of our nursing profession.
Colleagues, please mute yourselves.
It identifies our roles and responsibilities in a certain setting to perform safe, competent, and ethical care as defined by our education here in South Africa, our legislation, and SANC, of course. Okay. Whereas practice standards are benchmarks and they're statements so that we can be measured against a national standard. And it is often what the regulatory body expects of its registered nurses against what is expected or how we should practice. And those standards can be measured by the public, clients, patients, employers, and colleagues. Forward. So the purpose of the scope of practice is to regulate the OHNs, in other words, guide our curriculums, assist the employers, enable to prepare job descriptions for the OHNs and OHMPs, perform our performance contracts. In other words, what your key performance indexes will be. And like we said, the other purpose of the scope of practice is to help the public understand the services that its members are qualified to provide. On the other hand, a lot of standards around, but they are there. The purpose is to guide and direct the practice promote professional practice, facilitate the evaluation of our health in our case, enable the users to judge whether we are adequately providing what we should be. And it's going to provide guidance to nurse educators, administrators, and researchers. Okay. Whereas the competencies provide the framework that we're going to assess, specifically a newly qualified practitioner in ARC Health, as well as SANC has the proposal that it will be doing this on an annual renewal license process. So ARC Health nurses out there, just be aware that if you've got legacy qualifications, you're going to have to up yourself on additional courses in competency. The competency framework the purpose is to help those, not just help, assess those that are coming overseas to practice ARC Health here in the country, and conduct matters. So if we get reported for omissions or neglect, they would use our competencies to determine that. So it's a very important document. So where do we find these? I've just shown you the SANC's position paper on it, and then they've got the scope of practice itself, which is a very generalized approach to it, all the way down at the bottom of the SANC page. So these links will be there for you to have a look at closer detail. And we are now working on SANC's Regulation 2127 of June 2022. And it basically, I'm going to summarize it in the slides here for you, but it basically addresses the professional nurse, who can be a specialist nurse or an advanced nurse practitioner, which is either a specialist nurse or the master's nurse. Then it's got a scope of practice. Should you employ just a normal professional nurse, an auxiliary staff nurse who end up being assistants in the clinic? Okay. Our standards, our practice standards, are extremely vast that we need to consider. And that's why we go on additional training, because we need to be familiar with IEC standards that will guide our practice. ICO, the International Commission, also has a code of ethics and guidelines on what the OH, and I'm going to say OHPs for now, so both of us, what we need to do. And then SCONE, the Scientific Committee of ARC Health Nurses at ICO, focus on the nurses. So if you're looking for what should the OHN be doing, that would be your international reference. Then nationally would be your SAN standards, thousands of them with regards to specific advanced skills like audio, vision, and spirometry testing. We have the Office of Health Standards Compliance, who will be coming around in the near future to be doing audits on all health facilities. And that's where we'll be evaluated again. And then, of course, there's the SANC regulations, ethics policies, and statements and guidelines that will guide us as to what we would be allowed to do in ARC Health. Okay. And of easy reference would be, make sure that you get yourself the SASOM and SASON guidelines, because that's very specific to the ARC Health industry and how we work together. And then, of course, the competencies. Yes, the competencies. And if you go right down to the bottom, there we go, the ARC Health nurses. I'm going to open that because we're going to use that just now. And towards the middle, page 3 onwards, you will then find what specific tasks we are meant to be competent in. And like I mentioned, we have legacy qualifications, and the qualification was revised for postgraduate at level 8 by SANC in 2015. Okay, so you're going to have 2 groups of OHNs currently practicing in South Africa. And yeah, just to be aware that we need to fill those gaps with competency training in between. So let's take, for example, the question of I need to contract or employ an OHN and an OHMP, and why do I need to do this? There's three major reasons that I've highlighted, and hopefully in this context, we'll be able to address the other objectives I had in the beginning. So, yes, although you might have a staff wellness program in place, it is merely there to supplement the OC Health surveillance program. It doesn't have all the legal requirements that the OC Health program does. And this is one of them. Why do we run these programs and who does it? So if we look at the purposes and the difference between those two programs, the OC Health program, we need to be looking at detecting and preventing early diseases in individuals and then later in the group. So yes, both workplace wellness and OC Health do the same thing. When we look at trying to detect and prevent early occupational diseases, your practitioners that are practicing in the wellness programs usually are just professional nurses and auxiliaries and so on. They do not have the scope to be able to identify and prevent early OC Health diseases. Okay. Then there's the purpose, those two programs, of preventing deterioration in health status as certified by a fitness of certificate issued by the OC Health practitioners. Only an OC Health practitioner is allowed to sign off certificates, and the OC Health nurse is limited to certain certificates, okay, which we'll go into now. Whereas on your wellness side, the professionals there do not have the legal mandate to be able to do that. Okay. Both programs look at promoting activities like, for instance, managing chronic conditions when the person comes in for their surveillance. The promotion of activities with regards to hierarchical control measures is addressed in the OC Health program, but not in those wellness programs. The professionals there are just not trained in OC Health to understand or apply themselves. Okay. And another big purpose in the two programs would be to detect trends so that we can adjust the preventative, promotive, and rehabilitative interventions in the program, which in both cases, you'll have professionals on both sides who can do that. So like I mentioned, there are only specific professionals who can do an OC Health surveillance program, and those are the OC Health nurse practitioner and the OC Health medical practitioner, not the safety officer, not the hygienist. It's just those two. When you come to the wellness side, you'll often see, professional nurse advertising that she does this for companies. Please keep in mind she is using general medical officers. She's referring or having a wellness day that involves a psychologist or a dietitian or someone coming on a day visit. So it's a once-off and it's not a comprehensive thing. And if they do have a comprehensive program, like I mentioned, their scope is limited. Okay, they are focusing on short-term management of diseases. Okay, which gives me to this one. What are the needs? In both cases, the OHN, that's what we do. We have to do a needs analysis or a risk assessment. Okay, and we start off with an organizational analysis, and we look at the legislation that covers that particular industry. Okay. Whereas the wellness programs, there's no legal requirement to look at any sort of legislation. Okay, other than, don't go beyond testing or screening for glucose and BMIs and things like that. Okay. Then the philosophy behind the service that we're providing is that in the occupational health surveillance programs, we have an occupational health hat on. Okay. Whereas on the wellness side, it is very much the primary healthcare approach. The populations that we serve and the trends that we're looking at is long-term, predominantly focused on long-term in the OC Health surveillance and short-term in the wellness ones. Facilities. In both cases, we'll have the Office of Health Standards Committee that will audit in the near future, And financially, when it comes to OCHealth, the company is legally obligated to budget for OCHealth surveillance, whereas on the wellness side, it's an optional, it's a nice to have. Okay, so I have, if I can just get the share for a moment, you will see the book that basically, oops, sorry, the session book that many of us have. Denise was one of the editors, myself as well. So in chapter 8, it will give you a little bit more detail of the differences. Okay. Let's continue on our slides. Let's share. And just hide that for a moment. Okay, so when we conduct that risk assessment or a needs assessment, there are two things that we do in the industry, and that is a HIRA, which is a hazard identification risk assessment, and the other one is a health risk assessment. Okay, so when it comes to the HIRA, both the OHNP and the hygienists are involved in that. Okay, and it can take different levels of from inspection to a comprehensive one. Okay, it needs to be comprehensive in OCHealth, and it's usually just a site inspection in the wellness side. We've got to be able to identify employees exposed to certain substances, organ systems, and so on. In the wellness services, they are just doing a general screening, and there's no target organ assessment. Okay. Part of that HIRA, we need to do or compile an occupational risk exposure profile for each homogeneous group. And that is done by the OHNP and the SHEC department, but not done by the wellness guys. Part of that risk assessment is the absenteeism trends, which the OHNP works with the HR department to do that. Okay. Wellness, they will look at absenteeism with HR. When it comes to the health risk assessment, now that's the individual. In other words, how do we assess how well this person is, or how are they being affected by their exposures? And it, again, as you can see, I'm just going to highlight here, it takes different levels of health risk assessment. And that's why you'll often see, like in COVID, just a questionnaire was handed out, and suddenly the safety guys and the hygienists and the security people were suddenly getting involved in health risk assessments, okay, which does compromise confidential information, okay, but because COVID was a public health risk, and it was an emergency, the Emergency Act was instituted, that overrid anything. Okay, so when it comes to health risk assessment, it is only the occupational health nurse and doctor who can do it in the occupational setting, okay? And we might, at some stage, only use questionnaires. Ideally, we need to use this last level, which is we conduct a comprehensive history attached to how your OREP is expecting you to work and hazards you'll be exposed to, your vitals. We do risk-based biological monitoring. We do specialized tests and functional fitness tests, and we do a head-to-toe examination, okay? Whereas that is not covered by the wellness program. They might at very most be able to do level C if they've got an additional qualification like primary healthcare. But most of them are registered nurses and or auxiliary nurses. So their scope is limited. Our scope is wider, okay, because of our qualification. And that's where our qualifications differ. Just to quickly highlight that a lot of legacy qualifications, and just keep note of those years that are written there. As from 2019, all your new graduates need to have both doctors and nurses, a postgraduate diploma at an NQF level 8. In the past, it was at a 7. And so anyone who comes for a job interview or promoting their service, please, they need to then provide what we call continued professional development evidence that they have upped their quality, their competencies to what NQF level 8 is required. And by all means, they can go on to a master's bar coursework to become advanced specialists. Okay. And of course, we are registered with 2 different organizations, the nurses with SANC and SASHON, and the doctors with HPCSA and SASOM. And it must reflect on, in both cases, on our council receipts, okay? And you can go onto the register and have a look if it reflects there, e-register, okay? I'm going to leave it to my colleague to focus on the Occ Health doctor. We're going to continue with the next reason. Like I mentioned, if you're going to do Occ Health or have an Occ Health service, the other reason for employing the OHN would be the additional specialized qualification since the 1950s. Okay, and that was internationally required and became a requirement after World War II. In South Africa, that requirement only really happened after the Erasmus Commission, and now in the 2000s, due to further international influence from Higher Education Council and ICA and so on, we now have the 2 with this NQF level 8 requirement. And the subjects, just as this is what changes our scope of practice, is that the nurses do an additional nursing science subject where we've got to really be competent in audio, spiro, vision screening, and a few other skills, okay? So I've highlighted that. We do a little bit more, both of us are doing emergency care, but we do emergency preparedness, and you often see the safety guys trying to do that too, but you need to involve the OHPs in this, okay? We do a subject on public health, so we get intros to epidemiology and environmental health, but it's introductions, okay? We both do business management and administration subjects. We both get introduced to travel health, and a big component, because one of our roles is consultants, is that we all the legal aspects related to those subjects is covered inside each subject. So we don't have a separate subject, it's integrated. Okay. Another reason to have OHN or OHP would be that the roles are expanding based on the situational analyses that are happening currently, and additional competencies required to fulfill those needs. There are some sources that are available for you that you can just take a deeper look at the evidence that's been collected. Okay, so our contemporary roles are, we are advanced specialist nurses. That's our clinical role. We are consultants and advocates. We are educators. We are researchers, and we are managers and leaders. So those are our roles. What's our scope of practice? And those roles expand into, on the clinical side, we have to be able to manage and provide and implement and evaluate preventative programs, from the occupational health assessment programs to monitoring biomarkers and so on. We have the promotive programs. So remember, you don't have to employ a separate wellness service. It is part of your occupational health service. Okay. That's what the OHNs do. We have a curative side where many of us have dispensing licenses and can provide primary health care. Rehabilitative programs and COID, just to mention a few. On the consultancy side, we are expected to know our medical legal framework very well. We will be able to consult on absenteeism management, incapacity and disability, and the hierarchy of controls. Okay. From the our education role is we are expected to mentor both doctors and nurses who are going as postgraduates into Occ Health. So please make sure that your companies are open to training new doctors and nurses. We then also train the worker. And some of us have additional qualifications in nurse education in order to train in the universities, this specialty. As researchers, our role as researchers is we get expected to manage data, many various types of data, okay, both confidential health data as well as trend analysis and epidemiology and so on. Okay. From our management role, we are expected to be able to conduct project management, case management, quality improvement programs. Some of us, well, at least most of us, are operational management of running that clinic, and some of us strategic management when we are running companies and or sitting at executive levels. So let's take one example of just trying to run the Occupational surveillance program. Here is just a quick insight. I just took a couple of snippets from that general scope of practice for a professional nurse. And it says, our scope is to be able to advocate for the profession, facilitate the establishment of that clinic and maintenance of an environment in which healthcare can be provided safely and optimally. In other words, we need to run those clinics. We provide safe and quality care in a scientific, integrated and evidence-based approach. So we are part of the SHEC team in order to adjust the surveillance program. We practice under a code of ethics. We have to facilitate the attainment of optimal health for those individuals. That's why I say it's not just the individual, it's family, groups, and the community around us. And if that's what SANC is allowing us to do, it then gets possibly reduced based on the capacity at the site. In other words, the site might only be able to look after the workers and not the community around them. Okay, but that's just an example. I just wanted to show you, it goes on, SANC scope of practice allows us to diagnose and prioritize individual health and care needs based on comprehensive analysis and integrated data. Okay, so a lot of people get confused between a nursing diagnosis and a medical diagnosis. Nursing diagnosis, I'll give an example now. It's our scope to be able to provide emergency care. It's our scope to provide palliative care and end of life. So that's where we are involved in the rehabilitative side in the Occupational setting. We've got to be able to manage individuals, groups, and communities while integrating them, okay, with regards to culture and so on. So we do a lot of additional work, okay, and that is again determined by our standards. And the one that I want to highlight here, I just see now, hang on, let me just go out of the Zoom, will be the SASHA position statement on which types of occupational health surveillance certificates we are allowed to sign off. So when you go to the SASHA website and you go to the question about medicals, here is the position statement that, for instance, will say, let's say we're working in the construction industry. Both the Occupational nurses and the doctors may sign those off, okay? Except for when somebody is sitting on suspended platforms. The asbestos has to be a medical doctor. The nurse can't do that one. Diving regulations, the Occupational doctor will have to do that one. All right, and then so it goes on. Because my time is limited and it's almost up, we'll, for instance, my forte is noise-induced hearing loss regulations. So here it is the Occupational nurse that signs it off, manages it, and refers any abnormal to the doctor. The doctor doesn't have to see each and every test, okay? Just the abnormals and those with early noise-induced hearing loss, okay? And that has been enabled by the competencies that we are assessed against. We have to show Nursing Council and our tertiary institutions before we graduate that we can determine the suitability and fitness of employment of certain categories of employees based on their OREPs, that we can assess and monitor clinical interventions in optimal safety, that we use data to adjust that program and make the assessments. We don't just simply do head to toe. We focus on certain areas. For instance, if it is construction, we need to be able to do ergonomic assessments. Okay, and it's basic ergonomics. When we do pick up something, we then refer them to the ergonomist, for instance. Okay. Alrighty. When it comes to, so just to summarize quickly, we both compile and review the health and safety related companies' policies and standard operating procedures. Both of us co-designed, co-approved the Occ Health Surveillance Program. However, it is the nurse, our scope is to then implement and evaluate that program. So we're often involved in the reports at the end. Both of us case manage, whereas the doctor, Occ Health doctor, has the additional medical treatment that he might prescribe. Okay. We both monitor trends. We both evaluate the effectiveness of the interventions. The doctor has, which our scope is limited, he needs to authorize certain dispensing protocols in regards to medication. And just like us, we had to go into additional courses in audio and spiral and vision. The doctors will have additional competencies in respect of, will need to, above their normal qualification, go and do diving, medical training, aviation medical training, and so on. Okay, so that's just a quick overview. And for the future, Michelle and Rispel from a PhD study had found that the majority of South African occupational practitioners were of the opinion that a statutory accreditation of occupational health services would improve what quality of service delivery you see today. And this is all pending the government departments getting involved, the coalition between our stakeholders, the development of specific standards. Again, there's a lot of guidelines around and not enough standards. The education and the training of the OHPs to meet those standards. So there's quite a bit of development still for the future there. In the interim, we recommend that you use these two tools, the SASOM and SASON tool. The SASON tool has been more frequently reviewed, refined, and implemented, and is being used by both SASOM and SASON members in assessing the quality of what that OHN is delivering on the ground. Okay, it addresses the alignment of the practice standards and the extent that the OHMP's competency is required. So you can always just contact SASON and ask for SASON audits to be organized. There's certain times of the year because these are volunteers. But yeah, that's also something we hope in the future will increase. And another future that we see is that both the OHMP and OHMs continue to be present at all the relevant senior management, not just little meetings here and there, senior management and health and safety meeting as formidable assets in the SHEC team. Thank you so much for your time this evening and your patience, and a big thank you to the AHESA team for hosting the event tonight. To Denise, thank you for staying and answering any questions, and to the SASON Executive Committee for the OHNP developments. And to contact SASON, here's your contact details, and we look forward to your questions. Thank you so much.
Thank you very much. That was quite informative. I spoke to Sister Angie a little bit earlier today, and She was apologizing for her presentation being too long and asked me to cut the bits that I think are not important. And I'm sure you can all agree with me. There's nothing that's not important there. All right, colleagues, as the sister has indicated, she is not around today to answer your questions, but we have the most important colleague of hers, Sister Denise Mini, who is an occupational health nurse for over 20 years. She's an honorary life session member, immediate past president of Sashon from 2016 to 2021. She was also a currently International Congress of Occupational Health, WOPS, which stands for Workplace Organizational Psychosocial Stressors Committee. She's a co-chair and secretary for the second term of office. She is currently employed as an occupational health nursing practitioner at Rand Water, and that's where she also assists with side forums, wage negotiations, employment equity, and stakeholders. As you may have learned, occupational nurses can do quite a lot. She's currently studying business management at the University of Cape Town, and when she's not being an occupational health nurse, she enjoys hiking, Pilates, yoga, and baking. May I please ask you to share your questions for Sister Mini to answer? And let's welcome Sister Mini and ask her to unmute herself. Thank you very much. Sister, are you there?
Yes, Dr. Nkonazi, I am here. I'm going to assist to the best of my ability
All
to
right.
answer whatever questions you have. Good evening, colleagues.
And welcome, Sister.
Thank you.
All right. The question I have so far, Sister, let's have a look, from Sister Odette Skuman, was whether they will get a copy of recording at the end of the session. Yes, everybody will get an opportunity to go through the presentation again, because remember in the beginning we said that we post everything on YouTube. So that usually takes 2 to 5 days, depending on how hectic the schedule is at the office. But we normally post all the presentations, including the previous ones, will be there. There was an issue about no sound at some point. I'm sure that got resolved. And then I'm just going through the questions, but by a show of hand, anybody that has a question may raise a hand and I'll allow them to speak.
Just to add, Dr. Nkonazi, those that would like to also see the session position paper, that is also available on the session website, because I think that document is of most relevance to all those that are practicing OC health in the industries.
Okay. All right. Thank you. Sister, I have a question here. Where do we get, and this is from Hayla, where do we get the information to update our competencies for those qualified occupational health nurses before, let me just check, before 2019?
Okay, so those that have been doing the legacy qualifications, and now that you have to, as Sister Angie has indicated, you would now have to upgrade because of the higher education institutions, their requirements and the criteria that they want us to fulfill. It means that whatever qualifications now that you are going to have, you would have to take it through to South African Nursing Council, which is SANC, and they will have to approve that qualification of yours. But if you have other qualifications like audiometry and those things, SANC is not going to have that on your certificate from them. You would have to keep those qualifications in a portfolio of evidence. So in any case, if you would be audited, those are the qualifications that you would have to show an auditor. Most companies now, they have the South Africa, the SABS audits or any other auditing company. And when they audit the clinic, they want to see that you firstly are a qualified occupational health nurse. What is your qualifications? Where did you get these qualifications from? And do you have some of those competencies? If you are testing for noise, it means that you would, and you are doing audiometry tests, then it means that you need to have that competency certificate, and that is what you can show. But anything that, if you are a qualified occupational health nurse, SANC would have to get those documents so that when you receive your receipt from SANC, it needs to say there that you have an added qualification in occupational health. I'm not sure if I've answered the sister's question.
I think it does, sister. Thank you very much. Do we have any other question? Do we have hands? Okay, I think sister is satisfied there. All right. There is a hand from Diallo. Please continue.
Good evening, everyone, colleagues and Dr. Mkonazi and the sister. I want to ask, I heard the sister speaking of audits being done. Is it done by that department, or if yes, then how do you get them to do the audit in your workplace?
Okay, so basically what Session has done, Session has taken an initiative, it was in 2013, where it wanted to develop a few auditors, Session auditors. Because we were concentrating mainly on the quality of occupational health services and to protect the occupational health nurses, an initiative was done in 2013 to develop a few occupational health nurses into auditors that would be Session auditors. And thereafter, we've created a Session audit tool. And that audit tool is actually to ensure that your clinic meets all of those expectations. That if your company should have an external auditor, like the SABS, whatever they would be looking for, and based on the Session tool, you would not be having any findings. So if you would like to benchmark and see whether your clinic is up to scratch or it's actually in compliance with what is requested in occupational health, I would suggest get a copy of the Session audit tool, work through it, and you will see that it's been revised many a time. And I think the latest revision was now in 2022, 2023. And just by going through each and every of those requirements, you will see that you will be able to comply with everything that is required now in occupational health. In terms of getting your clinic audited, you would have to put through, a request. So what we normally do is that we actually encourage the nurses, occupational health nurses, or that belong to Session. We make a big deal about it because we have accolades where you can get, a corporate award for the best occupational health nurse or best corporate occupational health team. And what we're actually encouraging is that these clinics would want to be audited by one of the Session audits. So what we would do is that Session auditors would come out, they would go through your clinic, see whether you meet all of the requirements, and then almost like give you a mark out of that 100%. Now, you would find that you would need to score 90% because occupational health, you work as an independent practitioner. So we want you as an independent practitioner to be able to render the services confidently, to know what you are doing. And you in turn, because you would want to be audited, you would get permission from your employer to say, I would like the occupational health clinic to be audited. Once that employer has given us the go-ahead, the session auditors come on board, we do that. And if you pass and you get this 90%, you then qualify, you know, with whoever is being audited at that time for that accolade that will be done at the session conference when it's the gala dinner. So there's a whole lot of accolades that will be given, but this is how the whole process actually then takes place. In terms of having an external audit, you will find that it will depend from the external auditors whether they would want to then audit you, or they would say, you know, they want to do an audit on the occupational health clinic. And that is maybe because of the ISO standards. You know, before we used to have the OSH Act, which, the 18,000. Now we're looking at, you know, the ISO standards. So we're looking more at quality standards. So it just depends on what exactly would you like, whether you'd like a session audit or whether you would want to have an external audit. Thank you.
All right. Thank you very much, Sister Denise. I would like to continue with the second session, but I'm humbly asking you to stay over for the last Q&A session at the end. I think we have addressed all the burning questions and we can now continue with the not so important stuff. Thank you, Sister.
Okay, thank you.
Okay, colleagues, as we all know, in occupational clinics, occupational doctors, or as we are famously known in our country, occupational medical practitioners are always there to lend a hand or support occupational nurses in healthcare service. My presentation comes with a warning that mine is not gonna go anywhere close to Sister Angie's presentation, because I know as doctors, our attention span is very short. So I have tried to summarize everything I'm going to say within 20 to 30 minutes. Colleagues, just one last point. I'm aware that it is full and some people are being kicked out and some are not able to join. Kindly please note that this whole presentation is being recorded and will be posted on YouTube. The platform is called OHESA DLP, or OHESA Digital Learning Platform. I promise within the next few days, by the end of the week, let me say, the video will be up and you'll be able to watch it without stressing about getting dropped. Thank you very much. So when it comes to occupational medical practitioners, we are medical practitioners, as the name suggests. We would have a basic medical degree, and this is obviously in the South African setting. We will have basic medical degree with at least a postgraduate diploma in occupational health that can be done at different universities. So the formal definition of occupational physicians is that we are qualified medical practitioners with specialist training in occupational medicine, practicing preventative medicine in the workplace. The occupational physician has the skills and knowledge required to meet the needs of businesses and ensure optimum health of all employees. The important thing to note here is that we are also involved in the day-to-day business of the workplace or where we find ourselves, because we have to provide advisory service, sometimes consulting service. So it is part of our responsibilities to know and understand what it is that the business does. And in addition to this, we also, like I've said, have an understanding of how the business operates. Management skills and understanding is also part of our scope. Prevention of occupational diseases and other work-related illnesses, knowledge of potential risks to health that can occur at work, and recommendations to reduce or eliminate hazards in the workplace. Knowledge of health, safety, and employment law, And with this, I remember from time to time we have to interpret the law, and I think it's such an important part of our role. And then risk assessment techniques to assess health risks to individuals and at-risk groups or employees. Remember, occupational health takes the approach of public health where prevention weighs heavier than anything else. So the priority is to make sure that we prevent disease, we prevent accidents, we prevent anything that may result in negative health outcomes. So when we do risk assessment, you'll recall from our previous sessions, the whole idea is to prevent damage from happening before it does actually happen. So basic rules as per ICOH, SASOM, and obviously a little bit from HPCSA is that we provide business advisory where we advise the companies on health matters, usually each and everything that has to do with health in the workplace. And then we advise on health and safety policies, practices, and procedures, and including drafting these policies where they do not exist or giving comments on policies that have been drafted. We are heavily involved in absenteeism management. Think about a situation where an employee is referred to you for being absent at work. Your main role as an occupational medical practitioner is to identify what's causing him or her to be absent from work. So basically to establish if it's a case of an incapacity or just inability of the employee to obey the laws or to attend to a workplace. So our role there is to make sure that if there is any illness, we identify what is wrong with the patient in consultation with their treating doctors, and then we advise management accordingly. So we do have power to prevent people from being fired sometimes, especially where illness is concerned. Medical and health surveillance, this is where we are involved in medical surveillance programs from planning, design, execution, and authorizing fitness certificates. And then health monitoring. Remember that healthcare is like a video that goes on. What is not a problem today could wake up the following day being a problem, or could turn out to be something of a hazard or something that may impact employees. So we continue to monitor this in the workplace. And whenever we are in the clinic, we don't only focus on prevention, we also make sure that we monitor certain health indices to make sure people remain healthy and to make sure that the employer gets the return on investment. Policy and guideline formulation, like I have said, we do design policies and guidelines in the workplace. We also provide training and education. Traditionally, a doctor often has to assume the role of being an educator or a trainer. And this is not only limited to colleagues, but also to patients when they need clarity on what is wrong with them, how does their illnesses affect their health, or anything that has to do with health. So we are also ready to step in as educators or trainers in the workplace. And then based on SASOM, and I've just summarized our functions in terms of different sources, but based on SASOM, occupational medical practitioners provide 4 different services. Under general, you have your you have workplace occupational health and safety assessments, development and application of procedures and standards for medical testing. You have corporate assistance. This is under general. You have shop floor training. You have health and wellness promotion. You have research. You have special functions. The second role that we play is clinical occupational medicine, which includes general duties, medical duties, I mean, and fitness to work assessments and certification, medical surveillance, ill health capacity and incapacity, fitness for duty, overall responsibility for healthcare matters in the workplace, first aid and emergency, compensation of occupational injuries and diseases, incident management, rehabilitation, and in the third role, we have primary health care and wellness, which includes wellness interventions, primary care services, primary care and wellness legacy in occupational health services, and primary health. Yeah, and they say primary health care may take the form of treatment of minor and occupational and non-occupational injuries. Service may be offered by a medical practitioner or by professional nurse in the absence of medical practitioner, monitoring and management of chronic diseases. And then finally, we have assisting management with sick absenteeism, as we have alluded, and ill health, incapacity, and medical training, medical testing. And then the other team members that we have within the occupational health setting, we have what we call occupational medical specialists or occupational medicine specialists. These are medical practitioners by profession who have undergone intensive training at the university. They are often referred to as specialists because they go through the normal registrarship for 4 years at different universities, and they also write board exams from the colleges of medicine of South Africa. And then those are what we call specialists, and by profession, they are the highest form of medical health professionals that you can find in our country. And they are often found at academic institutions or in private consulting companies. And then we have what we call occupational health technicians. Occupational health technicians are semi-skilled professionals or workers that we find within the clinic environment. They are usually registered as audiometrists by SASHON, and they are often trained in audiometry, where they are called audiometrists. And then they are trained in vision screening also. They are also trained in spirometry, where they perform lung function tests. These are the people we go to in clinics when we need some tests done, and they also double up in most cases as administrative workers. But over and above that, we do have administrative workers or secretaries or receptionists, depending on the structure of the clinic itself. All right, I don't know if there are any questions at this stage that we can address. Otherwise, I'll go ahead and continue the rest of the presentation. Is there any question, colleagues, by show of hand? All right, let's proceed. Yeah, in this session, we'll briefly summarize what goes on in the clinics, why these occupational health clinics exist, and we're starting with the legal framework. You'll remember that from Occupational Health and Safety Act, In mining sector, they use Mine Health and Safety Act. Section 8 says the employers are responsible for the health and safety of employees, and then there are certain instructions that are attached to this piece of legislation and regulations that we follow under the main umbrella of Occupational Health and Safety Act. And then we have Compensation of Occupational Injuries and Diseases Act, also known as ODMUA in the mining industry, where the compensation fund is established as an insurance for people that suffer injuries in the workplace. And the benefits we outlined, I think, in the previous session, which can be found on YouTube. Benefits such as temporary disablement, permanent disablement, medical aid, and death benefits. They are administered under this act. And then we have Labor Relations Act, which outlines procedures on leave and terminations, which we often find ourselves as medical practitioners and occupational nurses in the workplace, you know, administering from time to time. And other acts such as Road Traffic Management Act, where we deal with licensing of certain types of drivers. I can think of PDP drivers, you know, that public liability drivers that we normally do medicals on and clear within our clinics. Most of the times they're actually also done by GPs. And then we have, according to SASOM regulations, we have different classification of drivers based on the roles they play. Some drive heavy vehicles carrying hazardous materials. Some are just people who drive company cars. Some are people who drive courier vehicles. So they are classified based on what they are doing. Colleagues, occupational health, according to World Health Organization, is an area of work in public health to promote and maintain highest degree of physical, mental, social well-being of workers in all occupations. While occupational medicine is a branch of medicine which is concerned with the maintenance of health in the workplace, including prevention and treatment of diseases and injuries, with secondary objectives of maintaining and increasing productivity and social adjustment in the workplace. Generally, to summarize all the functions that we do, that we provide our primary mandate, which is risk assessment and medical surveillance. You will remember this from our previous presentations. Other responsibilities that we have as occupational healthcare workers in the workplace: incapacity and disability management, injury on duty, advisory and consultation with business or employers. And then according to the Department of Health policy on occupational health clinic services, these services are supposed to provide health promotion of wellness and prevention of occupational injuries and diseases, clinical services, where we offer emergency or urgent primary health care, as well as emergency medical care and monitoring of chronic conditions. So these are the services that are provided at the clinics or at these facilities. Occupational hygiene services, where we identify and recognize workplace hazards, and occupational hygiene as a quantitative profession. We actually do measure how much of each hazard we are encountering in the workplace. The practitioner will also make recommendations for control, monitoring, and evaluations of risk. You'll remember from our previous session that we dealt with this part also. Consultative sessions, where we act as consultants on occupational health matters to persons in the workplace, not only employees, but management, labor unions, and to persons outside workplaces, such as NGOs, community-based organizations, and referral centers and health institutions. Continuing with that, we also do some administration where we develop and maintain information systems, policies, and statutory records and reports. We do research where we get involved in relevant research in order to evaluate effectiveness of the services we provide and the developments of new trends. So for us to be able to provide evidence-based healthcare or evidence-based medicine, the research is very important because it enables us to keep in touch with the current trends and what's happening and the changes that are often implemented within the fields. Any other special programs that require special attention in a continuous way because of their contribution to morbidity and mortality rate. This may include HIV, nutrition, TB, cancers, or any healthcare problem that we encounter in the workplace. Also, employee assistance programs for people with socioeconomic issues. Sometimes they have substance abuse issues. We also deal with this in the workplace. Management of social and substance-related issues, and referral to psychologists and social workers. And lastly, colleagues, we have different models of healthcare that are provided in South Africa. We have on-site clinics that are often owned by the employer, run by the employer, where the employer may actually employ the nurse, the doctor sometimes, or contract the doctor to come in from time to time, employ administrative people, employ the occupational health technician to run a health service. And then there are various regulations that regulate such a setup. The advantage is that the employer gets to manage the clinic and is kept up to date with everything that's happening within the clinic environment. The employer is part of solutions and part of, discussions that affect employees. So this is like a hands-on employer that gets to be involved in very critical matters of healthcare. Also keeping in mind that confidentiality forms the basis of our profession. So the employer in this case will know what they have to know, not everything, including that what they are not supposed to know. We have what we call mobile clinics that are often operated by occupational nurses, sometimes occupational doctors. The advantage in this instance is that the clinic is able to reach a wider audience or a wider coverage and provide services from the comfort of the mobile, often a trailer or a specially designed vehicle that is able to offer all the services that occupational clinics offer. So like I've said, the advantage is that we are able to cover a wider geographical area. You are not only limited to one place where you wait for people to walk in or where you are only servicing one client. You can actually have tens and hundreds of clients that you service on schedule, that you go to, and it's cheaper for them because they don't have to employ you or they just pay for what they get. So it's a pay as you go more like kind of a service where you just pay for what you need as the employer. We have on-site clinics that are managed by third parties or certain companies where service level agreements are signed between these companies and the company. As a healthcare company will hire a nurse, a doctor, by this I mean occupational medical practitioner, administrative people that provide healthcare in the workplace on the premises of this employer. But because there is a service level agreement between the employer and the third party company, all the employer has to worry about is paying the company or the service provider, and everything else is handled by the service provider. The advantage here is that you are leaving healthcare to those people who know it best. You don't have to worry about buying Panado or buying consumables as the employer. You just pay somebody to do what they do best, and you just sit back and reap the benefits. So this is a commonly practiced model in our country, where most of the sisters or most of the occupational nurses are employed by private companies that are contracted to the employer, and they service the employer. And the other advantage is that because you are not employed by that same employer, you do really have freedom of expression and ability to exercise your profession without worrying about your payday and, you know, being disciplined for taking certain decisions. You are employed by somebody else who has nothing to do with the employer of your patients. And then we have walk-in private clinics. And these are often situated in busy industrial areas where business opportunities have been realized, and employers within that area will simply just call in, refer their patients for medicals, and, you know, walk out with their fitness certificates, and from time to time call in the professionals for consultation if they don't understand what is happening, or if they need more clarity on the issues relating to their company medicals. This is also commonly practiced. We also see these clinics within the industrial areas, but there are usually no memorandums of understanding or service level agreements. Everybody's just welcome, like any other public health clinic that we see in our villages, townships, and suburbs. If you need medicals, you just phone in, make an appointment, and get the convenience of being helped when it suits you. And then finally, we have consulting services. Not very common in our country, but we do have consulting practices from time to time, like the one I'm running, where the practitioner has his own clients that he services, and you provide advisory, you provide clinic management, clinical management of patients, incapacity management, management of occupational health injuries, occupational diseases, anything that is health related that is required by the employer. And then, yeah, like I've said, you advise management on anything that has to do with health, or anything that might help with the return of investment as far as human capital is concerned. And then you manage health related matters as well, like pregnant people in the workplace, like disabled people, like older employees, or people with chronic diseases. And then we have managed and academic training facilities. The common example is National Institute of Occupational Health, which also serves as a referral point for other clinics or for other independent occupational medical practitioners. You do access occupational medicine specialists here, and they are often doubling up as research institutions with high patient turnovers. And this is actually a disadvantage, because sometimes when you need to make an appointment, you can actually manage to get one after a few months. And that's where the problem is. But, you know, we don't have many of this in our country. I can think of the clinic run by UCT in Tygerberg Hospital in Cape Town, and the one affiliated to Wits University, known as National Institute of Occupational Health in Johannesburg. And then you have healthcare institutions also where practitioners may be employed by institutions. Like I've said, practitioners also employed by university faculties engaging in secondary and tertiary occupational medicine services. And these are now the registrars, people who are training to become medical specialists. and also responsible for teaching students from time to time. Colleagues, I hope I've managed to finish my presentation on time. It's exactly 7:30. And I would like to welcome some questions and also remind you that our next session will be on the 31st of July, where we'll be discussing a holistic and correct approach to medical incapacity. But for now, I just want to go through some questions and see if we have any. Okay. Okay, I see a hand from Pauline. Please go ahead, Pauline.
All right, thank you for the presentation. My question is on the occupational medicine specialist training. You said you have very few specialists in the country. Just wondering whether there's actually universities that are training in South Africa. Is it an MEd that you need to get to qualify as a specialist? And if yes, which universities are giving that training? You talked also of registrars for NIH and VITS. I mean, is that the program that they're doing? They're training to become occupational medicine specialists, is it?
All right. Yes, thank you very much, Pauline. With regards to occupational medicine specialists, the format in South Africa is that you will undergo, I think it's 4 years of registrarship training at a recognized university. Universities such as University of Cape Town, Wits University, I think University of Pretoria, UKZN. I'm not sure about UKZN or University of KwaZulu-Natal. The difference here between the OMP and the occupational medical specialist is that an occupational medical practitioner will do a postgraduate degree for 2 years at the same university and graduate to become an OMP, occupational medical practitioner, who will be based mostly in the clinics or in private practice, depending on their desires. With regards to occupational medical specialists, they undergo the registrarship training for 4 years, I think. And then from there, they will write board exams from South African College of Medicine. So they will also, meaning they will have, at the end of their training, they will have masters in medicine, specializing in occupational medicine. And they will also have the fellowship qualification or fellowship certificate from colleges of medicine of South Africa. I don't know if that answers the question. So they are called specialists because they are trained like any other specialists are trained, like orthopedic surgeons, like general surgeons, physicians, obstetrics and gynecologists. So they will write all those exams that are applicable at the university. They will go for residency for 4 years, and they will write exams at the end, board exams from the colleges of medicine in South Africa, as opposed to occupational medical practitioners. You just, based on the structure of the program, attend the program for 2 years, get your qualification after exams or after oral exams, depending on the structure. And then from there, you don't need any certification by the College of Medicine in South Africa. And then you are qualified just like that after 2 years. Thank you very much, Pauline.
Thank you.
All right. Do we have any other question? Colleagues, we had this session because most of the time, the colleagues I come across with will ask me, how do you get into occupational health? Doc, I have finished my postgraduate diploma and I want to start. What can I do? And yeah, this session is for such people because I feel that there is more we can do in terms of occupational health in our country. And we actually have a lot of people that are qualified but are not practicing as a result. And I don't know if it's because of certain challenges that prevent them from practicing, or if the industry is not really easy to penetrate. But platforms like this exist for us to discuss these matters. Is there any other question, colleagues, by show of hand? I'm also monitoring the chat room. No questions, colleagues? Okay. I see colleagues are still registering for their CPDs or for their certificates. All right. Sister Minnie, at this point, we'll pause obviously if there is a question, but at this point, do you have any closing remarks?
Dr. Mkhwanazi, not from my side, but if I could just give a little words of advice for the occupational health nurses. If I could advise them that I think with the way things are happening now in industry and with the different laws that are coming in, I'm glad that you also touched on it, that it's advisable that they start, looking at labor laws, because those are things that actually can help both themselves and an employee, especially, when we have to have discussions with HR, etc. I think it puts them in the forefront of knowing what is right against good practice. So I find sometimes the nurses, they are scared to look at the labor laws, but I think it's always advisable to actually know what is your rights. And to also remember, as much as you are working in an industry or a company, you are also an employee as well. Thank you.
Thank you, Sister Denise. I have a question here from Selo. Except the PG, and I think that is postgraduate diploma, is there any other route, not talking about the college route? Selo, I think, and I think you're asking about medical practitioners. There are certain doctors or GPs that function within the occupational health space, but most of the times they are a bit limited to the primary health services side of things. So I would say to do yourself a favor and to make sure you are properly equipped and to be able to account and indemnify yourself for everything that you advise or prescribe within the workplace environment. It is wise to register for a postgraduate diploma and understand exactly what occupational health or occupational medicine is about. The advantage of doing the postgraduate diploma for people who are not really that clinical or interested in becoming medical specialists is that your scope of practice is very similar to a specialist, and you are able to do that at the comfort of continuing with your practice. So meaning you can still run your medical practice, attend academic blocks from time to time based on the structure that is being offered by the institution that you are registered with. So it is a part-time program that you can do. Sometimes exams will be written. For some institutions, exams are not even written. So I hope that answers your question. I see we have more questions. Just want to go up.
Dr. Nkonazi, I see there's one that says, what are the legalities around GPs working in an OC health and fulfilling OMP functions.
Yes, thank you very much, sister. You know, I think it's almost the same as performing surgeries that you are not qualified to do. Sometimes it gets more complicated and you are unable to explain yourself. So remember, as medical practitioners, we are accountable for everything that we do. So say, for instance, if as a GP you declare somebody fit to work who is otherwise not fit, simply because you are not familiar with certain requirements for that particular role and you haven't been trained properly, you would still be liable for the decision that you've made. And in this case, your client is the employer. Your client is not really the patient because you are being paid by the employer. Say, for instance, if the employer wants to sue you for damages based on the advice that you gave, or mostly because the employer also is under pressure for using that particular employee that you declared fit, you will be accountable because you were actually administering medical services, even if you are not qualified. So I would want colleagues to be very careful about something like that. And I would also want colleagues to consider doing the diploma, at least to understand the requirements of the job and be confident when you're providing service in such an environment. I see there's another question. And Sister Mini, I think this is yours. And how does this impact the OHNP who works with these GPs? Do you want to take it?
Okay, I think, yeah, you know, as a rule, if you are working and you see something is not right, I think as someone who has the qualification, who knows what is expected, who is the ones who can perform what is required in OCHAL, and in terms of compliance, you have every right then to, you know, bring it to the attention of your manager or bring it even to session's attention, because we've also had people, you know, who were not qualified. I think there were some that was even conducting occupational health services, but who were not even registered nurses, etc. And we've had to go, actually, it was in the time that I was president of session, where we actually then laid a complaint at the Department of Employment and Labor. And we've left it with their inspectors to actually go and inspect those services. And some of them were even using, you know, fraudulently letterheads, you know, from the Department of Labor or even the session letterheads. But it's up to us. Every one of these that are not doing the right thing, it is really up to us who has the knowledge, who knows, because, you know, me sitting in my space, I wouldn't know what's happening out there, but you would know. And I think if you want to do it anonymously, then just to, you know, alert somebody in session, and from there we'll take it. We have the means of how we handle it. You know, your employer sometimes might be upset that you've done this. So I think if you can just give us a tip off sometimes, it's nice. I think that's the only way we can regulate how we can actually, you know, comply to what is the rules and regulations. I'm not sure if I've answered my colleague.
Yeah, I think so, sister. I think that covers it. The next question is why the occupational health nursing practitioner qualification is not recognized such that we don't get distinguishing devices from SANC for occupational health. Do you know anything about that, sister? I think sister wants badges.
Yeah, I think no. To be very honest with you, I don't think they have any of those for the epaulets just yet. But at the same time, I can understand where SANC is also coming from. Remember, yes, we have occupational health as a specialist qualification, but you find there are others that have, advanced pediatrics, midwifery. I mean, we have the midwifery one, but there's many others for primary health, etc., that they don't have it. So I think the moment they have to start including all of that, I'm not sure where you're going to put all of those on the epaulet, because then we have to take into account the renal health nurses, etc. So I think maybe SANC is just concentrating just on the main ones. But maybe as a way forward, the sister could actually, put it to SANC, and maybe they could look into it.
If I may add something, Sister Denise,
Yes.
I've always thought that you do get like a specialty epaulet in addition to the basic ones you get for your program, but I may be mistaken. But I've always thought maybe when you go for like a postgraduate diploma, you'll get a postgraduate diploma epaulet, or I think they call it post-basic one. Is that not so?
Yeah, but we don't have those bars.
Yeah.
So I think SANC's understanding is that there are many specialities of nurses, and the moment they are going to start, catering different bars for all these specialities, then it becomes too much. And if you look at a person's epaulet as well, how many bars, I know a lot, many people refer to it as the fruit salad, but I think we also need to understand how many bars are actually going to fit onto that epaulet, number one. But the most interesting part is that when you look at the jobs that are actually recognized in terms of, I think it's called the OCD, it's an occupational document that's actually drafted by the Department of Employment and Labor in terms of the jobs that they recognize. You will see that they in that document, they talk about nurses, they talk about midwives and the primary health care. But occupational health does not feature there. So they haven't come down to the specialists in those categories of jobs. So I think going forward, we can ask of it. I will address it with SANC, and then maybe we can put it out, in the session newsletter, and we can see, what is the response that we get from SANC.
All right. Thank you very much, Sister. It does appear
But at the same time, I would like to also say, I hardly see the occupational health nurses wearing their epaulets.
that makes the two of us, Sister. The ones I'm usually in contact with know themselves. I've never seen them wearing them. All right. Thank you very much, everyone. I think we have come to the end of our session, and I hope it was informative. We'll meet again next month. Sister? I
Yes,
think
from
there's
my
another
side.
question.
Oh, okay.
After completion of a postgraduate diploma in occupational health, is it university's concern to ensure you are registered with SANC, or one register on his own? I think this is for you, Sister.
Okay, so what the higher education institutions are now doing is that they are trying to get everyone on the same level. And this is where I think Angie has brought it out very nice on her slides, where, she's actually saying at what is the criteria on which NQF level you are supposed to be. Because what
Mhm.
SANC has also done is that you will not be able to study further until you have met certain criteria. Now, the reason why SANC has done that is because we, as SANC, I mean, SANC cannot have its own set of rules, and the universities or higher education centers have a different set of rules. So, in order for all of us to comply, that's where that criteria is coming in. But seemingly so, once you have got this qualification, the onus is also on you to ensure that you forward all your documentations to SANC. So that SANC could actually, you would have to ensure that SANC actually receives the documents. The university, some of them, they do send it, but it's always wise also for the individual themselves to also check with SANC that they've received the documentation. And then when they get their receipt from SANC, when they pay for their annual subscription, you will find that they must ensure that that qualification is listed on that receipt that they get of proof of payment.
Okay, sister, we have a comment from Sister Lashiwe Matsule. Thank you. This was very informative. And then we have another one from, I think, Sister Hatting or Dr. Hatting. Why does nurses want to look like Christmas trees? Knowledge is in your head. I think that's straightforward, self-explanatory. And then we have another one from Vera Moroke. Thank you very much, colleagues. This was very informative. And yes, I think I've almost said bye-bye more than 3 times now, but I'm hoping I'm saying it for the last time. Colleagues, thank you for joining us tonight, and I would like to release you back to your families and thank them on our behalf for allowing you this time to spend some time with us. We know that this is very important time in your families. You've been away during the day and you only just got home now. And I see Sister Bosch from all the way from Western Cape. Thank you very much, sister. And we're looking forward to seeing you in the next ones. And Mr. Nkateko Makubele, thank you very much. This was our presenter from our previous session. Thank you very much. That's Andile. And this is where we end. Thank you very much, Sister Minnie. And we can't thank Sister Angie enough for managing to squeeze in some few minutes for us during the busiest time of her life. And we'll see you on the next one. Good evening.